white coating on the tongue can be a common occurrence, but it can also indicate underlying health conditions. In most cases, this coating is harmless and temporary, but it's essential to understand its potential causes. Let's explore what might be behind the white layer on your tongue, and when you should seek medical advice. What is a white coating on the tongue? A white coating on the tongue refers to the appearance of a pale or whitish film covering part or all of the tongue's surface. The tongue normally has a pinkish hue, and a slight white tint is natural due to the presence of papillae, the tiny bumps that give texture to the tongue. However, when the white layer becomes thick or patchy, it may be a sign of an underlying issue. How does it develop? The white coating forms when debris, dead cells, and bacteria get trapped between the inflamed papillae on the tongue. A variety of factors can cause this buildup, and they range from mild, everyday habits to more serious health conditions. Common causes of white coating on the tongue. Poor oral hygiene. One of the most common reasons for a white-coated tongue is inadequate oral care. When you don't brush your tongue or clean your mouth properly, bacteria, food particles, and dead cells can accumulate on the surface, resulting in a white appearance. Maintaining a good oral hygiene routine is crucial. Brush your tongue with a soft toothbrush or use a tongue scraper to remove any buildup. Regular brushing, flossing, and rinsing with an antibacterial mouthwash can help prevent further coating. Dehydration or dry mouth. When your body is dehydrated or you suffer from a dry mouth, also known as xerostomia, there is less saliva available to wash away debris and bacteria. This can result in a white film forming on the tongue. Stay hydrated by drinking plenty of water throughout the day. Chewing sugar-free gum or sucking on sugar-free candies can also stimulate saliva production. If chronic dry mouth persists, consult a healthcare professional. Oral thrush, also known as candidiasis. Oral thrush is a fungal infection caused by an overgrowth of the yeast Candida albicans. It often results in thick, white patches on the tongue and other areas of the mouth. This condition is more common in people with weakened immune systems, individuals using dentures or those taking certain medications like antibiotics or corticosteroids. Symptoms of oral thrush include white, creamy patches that can be wiped away, redness or soreness under the white coating, difficulty swallowing, and a cottony feeling in the mouth. If you suspect oral thrush, visit a healthcare provider. Antifungal medications, either topical or oral, are often prescribed to treat the infection. Leukoplakia is a condition that causes white or grayish patches to form on the tongue and other parts of the mouth. These patches cannot be easily scraped off and are usually painless. Leukoplakia is often linked to irritants like tobacco use, whether smoking or chewing or alcohol consumption. Leukoplakia itself isn't always dangerous, but in some cases it can lead to oral cancer. Quitting smoking, reducing alcohol intake, and seeking regular dental checkups are essential steps to take. Your dentist may recommend a biopsy to rule out precancerous cells. Geographic tongue is a benign condition where irregular, map-like red patches with white borders appear on the surface of the tongue. Although it may look concerning, geographic tongue is typically harmless and does not require treatment. Symptoms of geographic tongue include irregularly shaped white patches, red inflamed areas where the papillae have worn away, and possible sensitivity to spicy or acidic foods. Since geographic tongue is harmless, treatment is usually unnecessary. If discomfort occurs, avoiding spicy or acidic foods may help reduce sensitivity. Oral lichen planus is an inflammatory condition that can cause white, lace-like patches to form on the tongue and inside the cheeks. It's thought to be an immune response, but the exact cause is still unknown. While it can be uncomfortable, it's generally not dangerous. Symptoms of oral lichen planus include white or red patches, a burning or painful sensation, and blisters or sores in the mouth. If oral lichen planus is diagnosed, a healthcare professional may recommend corticosteroids or other medications to reduce inflammation and manage symptoms. Smoking and tobacco use. Tobacco use, particularly smoking, can cause the tongue to develop a white coating due to the heat, chemicals, and irritants involved. Smokers are also more prone to developing leukoplakia, which appears as white patches on the tongue and inner cheeks. Quitting smoking is the best way to prevent these white patches from forming. Not only will it improve your oral health, but it will also reduce the risk of more serious conditions like oral cancer. Nutritional deficiencies. A lack of certain vitamins and minerals, especially vitamin B12, folic acid, and iron, can contribute to a white tongue. These nutrients are essential for maintaining healthy oral tissues, and their absence can lead to various oral symptoms. Ensure you're consuming a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. If you suspect a deficiency, a healthcare provider may recommend blood tests and prescribe supplements. When to see a doctor. While a white coating on the tongue is often harmless, there are times when medical attention may be necessary. If your tongue's appearance doesn't improve with proper hygiene or is accompanied by other symptoms like pain, difficulty swallowing, or persistent bad breath, it's important to seek professional advice. Signs to watch for: persistent white patches that don't go away, pain or difficulty swallowing, redness, swelling, or sores in the mouth, white coating that lasts for more than 2 weeks. A white coating on the tongue can be caused by various factors, ranging from poor oral hygiene to more serious conditions like oral thrush or leukoplakia. Maintaining good oral hygiene, staying hydrated, and addressing any underlying health issues can help prevent or treat this condition. However, if you notice persistent or unusual symptoms, consulting a healthcare professional is the best course of action to ensure proper diagnosis and treatment. Maintaining a healthy mouth is crucial for overall well-being, so don't hesitate to take care of any oral health concerns promptly. For more dental tips, log on to smile-wide.co.in.